Hi, my name is Dr. Jothi Kumar. I'm an obstetrician and gynecologist with a special interest in fertility and IVF treatment. Well, there are no specific preparations required for the screening tests. As far as the female is concerned, it's best to see them during the first 3 days of their periods because that's the basal level and all the hormones at the basal level. And also, ultrasound done at that time, even during menstruation, will give us a basal status of the uterus and the ovaries. No fasting involved. You don't need to fast. We're not doing any lipid profile or anything of that sort. As far as the male is concerned, again, no fasting is required, but the semen collection is based on the WHO criteria where they have to abstain at least for 3 days, not longer. And when they collect their semen by masturbation, the container has to be given to the clinic within an hour. And some husbands are extra careful and they actually freeze it or put it in some heater. You don't need to do any of those things. It is at room temperature. You just collect it and bring it and give it to the clinic. Okay, so after all the relevant tests are done and we get the information, then we can organize a plan of management for the couple. So this plan of management is extremely important, both for the couple to understand how they're going to be managed. And this is dependent on 3 factors. First of all, as far as the female is concerned, does the investigations suggest a problem with ovulation? That's number 1. Number 2, does the investigations indicate that the tubes are damaged or blocked? And 3 is the semen analysis. Is there any problem with the semen analysis in terms of the count, the percentage moving, and the shape? So based on these 3 main factors, you do a plan of management. So let's start with the simple one. Let's say all the factors are normal, right? So then it becomes a question of advising them when to time the ovulation. Because the egg, as you know, only ovulates the ovary only ovulates once a month. The egg only survives for about 1 to 2 days in the fallopian tube. So you need to know the time when to do it. So we can advise them using very simple monitoring parameters based on their cycle length, or they have apps will indicate where they're going to ovulate, and based on that we can advise them to time the ovulation and have coitus at that time. Sometimes we can do even more definitive objective evidence in terms of doing an ultrasound scan, identifying when they're going to ovulate, because we can identify the main follicle when it's going to ovulate, and use that information and give that information to them and then let them try on their own, even using the LH kit to time the ovulation. So this is the plan of management initially. Let's say they try it for about a few months and it doesn't work. Then the next step is to use fertility tablets. That means you boost the number of eggs, and there are various fertility tablets that you take. So the strategy here is instead of 1 egg, you get 2 or 3 eggs to ovulate, and then again you time the ovulation for them and let them try. If there's some problem with the semen, then you can combine it with a procedure called intrauterine insemination. That's when, having taken fertility tablets, identify when they're going to ovulate. Instead of they having coitus on their own, we get the husband's sperm, pull out all the fast-moving sperm in the lab, and we deposit it into the uterus in the clinic. It's a simple office procedure. It takes only a few minutes, and they can go home after that. And usually the evidence shows that after about 3 to 6 cycles of this fertility tablets and IUI, you should get pregnant. If you don't, then you go to the final treatment, which is IVF.